All right. So thanks again for joining us. I would love to start by having each of you introduce yourself and your organization and any of the specific areas of rural health that are the most relevant to the work that you and your organization do. Um, Dr. Melvin, perhaps I can start with you.
Well, good morning. It's morning here, everyone. Very nice to meet you, Dr. Cochran-McClain, and very nice to have spoken with you, Annie. Um, my name is Sandra Melvin, and I'm the CEO and founding president for the Institute for the Advancement of Minority Health. And it was founded in 2019, right on the cusp of COVID-19. So as an epidemiologist, you can imagine that we stayed very busy in the early part of our beginning, dealing with a lot of the issues related to COVID-19 and health disparities that were related to that, disparities related to access to care. But since then, we also have implemented programs to target maternal and child health, as well as HIV and tobacco-related health disparities. Mississippi has one of the highest maternal mortality rates in the country. And so as we look at the work we're doing related to tobacco as well as reproductive health, we know that all of that plays into some of the maternal mortality rates that we see here. So really our mission is to reduce health disparities among disadvantaged, minority, and marginalized communities here in Mississippi. And we do it through a variety of ways. We do training. We train community health workers. We provide direct access to care. We also do communication campaigns to try to put messaging out there that the community that we serve understands and that's tailored for them. And most of our work is done through partnerships, as well as we have implemented systems to include the community's voice in our work. So most of our programs have a community advisory board that looks at everything that we do, and so that we can make sure that what we're doing is in line with what the community thinks we should be doing.
Thanks so much for sharing those issues of focus for you all and the way that you're connecting with the communities that you serve. I appreciate you sharing a little bit about that work. And Dr. Cochran-McClain, could you introduce yourself and tell us a little bit about your organization and the area of focus that you have?
Sure. So my name is Carrie Cochran-McClain. You can definitely call me Carrie during this conversation. And Dr. Melvin, it's great to meet you as well. So I am with the National Rural Health Association. We are a nonprofit, nonpartisan membership organization that really aims to lift up the voice of rural America in the national conversation around healthcare. And so our membership, I think we have 7 or 8 different membership categories that range from large healthcare systems that are primarily located in rural America, all the way down to individual patients and advocates. We work a lot in the public health space, a lot with specific rural providers like rural health clinics, as well as federally qualified health centers. All of the kinds of rural hospitals are out there, as well as advocates and students and state-based organizations and community-based organizations. So all that to say, we have a very large umbrella. And so as we think about kind of what we can bring to the national conversation, we think a lot about kind of 3 primary pillars for our advocacy and communications work. We focus, I think, first and foremost on rural health equity and really thinking about how we start to close the gap in what is a growing disparity between rural and urban life expectancy and health outcomes. And what are kind of not only the healthcare, but where we can address kind of some of the other systematic social drivers that create those inequities. And so, a lot of our work, like I said, is trying to get rural up to kind of the standard that many rural and or urban and suburban communities have, but we also recognize that within rural America, there are some significant inequities and specific populations that we really need to think about and target specific policies to address. We really run into some of that intersectionality between kind of geography and income and race and ethnicity and education status and all sorts of other things that make kind of that impact your life expectancy and health outcomes. So that's our first pillar. I would say our other two pillars are really making sure that we've got the healthcare infrastructure in place in rural America to support caring for those individuals. So are we maintaining a kind of a system that allows for rural hospitals to stay open and keep their doors open? Are we able to support the financial resources and the capital and the conditions of participation for our myriad of rural healthcare facilities out in rural America, everything from specialty care down to kind of long-term care to primary care? And then the third area of focus is around rural health workforce. And how do we make sure we've got the trained provider community to take care of individuals? How do we utilize people to the top of their license and skill set? How do we get kind of access to specialty care as well as key care coordination and thinking about who's part of that? And how do we use our community leaders and community voices as part of that conversation? So that's a quick snapshot. There's lots, like you said, Annie, there's lots to do in the space of healthcare. And it's all of those things we tackle at the national level, we tackle in rural. It's just with a different lens and kind of a unique look. So excited to be part of this conversation today.
Thank you so much. And it's going to be difficult to shift to using your first names. I want to make sure that you each get the credit you deserve for the credentials you've earned. Rosa, we're just going through introductions right now. I'm wondering if you can introduce yourself and your organization and the way that that work connects to rural health in the communities that you serve.
Sure. I'm Rosa Saavedra. Sorry, I joined a little bit late, but I'm up in the mountains in Puerto Rico in a very, very, very rural area. And I was not able to, I knew a place I could get connection, but I just wasn't there yet. And I thought I could get it where I was, but, and I would have been able to use my computer, but I couldn't. So that's one of the issues of living in rural areas, right? That we're all aware of. So the organization that I'm with is Compañeras Campesinas. Compañeras Campesinas is also a member of the Rural Coalition, and that's how we kind of amplify what our impact is in local communities. But what Compañeras Campesinas is a kind of a peer support network for Latina women living in rural areas of North Carolina and Puerto Rico. Within that, I mean, North Carolina is pretty big, but so we have specific counties that we kind of focus on where our membership is stronger. And in Puerto Rico, it's pretty much island-wide. We're building kind of community hubs in rural areas. They're not so much community hubs, but they're farmer-led. So in the rural areas, a lot of times agriculture is the big community kind of focus that people have in terms of economic, just because you're in the rural area and agriculture is something that folks can do and earn, earn a living, and also a necessary kind of business and infrastructure that rural communities need, because especially here in Puerto Rico, for example, when there is things that happen like hurricanes or storms or a lot of water, floods, you have to depend on getting your food locally. And the infrastructure for food distribution does not necessarily serve local communities. So in that aspect, the way that we try to include everything, even though agriculture is the first focus, what we understand is that folks who live in rural communities, and especially women, our voices are not heard very often, and it extends out. I was happy to hear, Carrie, I just see your first name, but I was happy to hear how that last part was kind of connecting with local folks to hear what their needs are and concerns are, also what their what the opportunities that they can bring to the table. So that's what we do, is we try to build with through peer support. We try to build that local capacity to integrate into these processes, which a lot of times come from outside the community, with good intentions, but sometimes just the outside factor creates a barrier. So, and that barrier, I know that those outside factors are trying to, kind of dismantle some of those barriers, but we really have to make sure that we can do it from both sides, so that there can be a real partnership, and a partnership that doesn't rely on the political aspects, in terms of, like in Puerto Rico, it's the mayor. The mayor's office runs the show. But it's good if you have a good mayor, but it's not so good if you don't have the kind of political representation at the local level, or even at the state level, and at the island level, that really is responsive to that particular community. So we want to make sure that people have not just that space at the table, but that space is being supported by the kind of network that folks need. I mean, when it's tough, because you're too not being listened to, it's hard to speak up. But also, when you're used to not listening to certain people, it's hard to listen. So we really try to make sure that we can build partnerships where partnerships can be built without relinquishing what is core to these communities, which is the sovereignty that they have. So we really want folks to listen to us, but we're not putting all of the power in the hands of those who believe that they have the most, because if there is a need for them to exist, and healthcare in terms of medical facilities, we understand that like we're the patients. Like I'm sitting here where there was not a clinic, right? So we understand that at the very least, we represent an economic force, and we need to make sure that we're come into these partnerships with knowing our value and being able to communicate that, so that we don't get left out when the whole economic piece is talked about, because we're part of that equation and we need to be considered as such. So that's the biggest thing, I think, that what our role is in terms of health. And it's not just about medical facilities, it's about access to healthy food. It's about access to all of the things that impact. I know I heard you say something, and I know I've heard it before. It's like those health indicators, right? We know about the things that impact our health. Stress is one of them. So in the relationships in our families is another thing. So it's all about understanding what are those points where we can say, transportation is another one, where we can say this is impacting individual health, because what we know is that in communities, we all need it. In rural communities, you need everybody. So if you have one person that's wherever the link in the chain, wherever that's weak, that's the vulnerable point for that to be broken. And so that's what we're looking at, is all of us are connected, and we're trying to make sure that we don't just look at things from this person, but how does each of these individual things represent a collective damage or a collective impact to our communities. The other side of that is, what are the things that represent collective strength? So I guess there's a whole lot more, but I'm thinking we'll be having more conversation, right?
Yeah. Yes, absolutely. And Rosa, thank you so much for sort of bringing it full circle. We were talking about the focus that Sandra has in the U.S. South on some specific issues that where there are health disparities and really trying to address those health disparities. Carrie, you talked about the rural focus and where there's some of these systemic issues, in particular for rural communities. And Rosa, I think you really added a really valuable piece to that conversation around the linkages in the chain, like you were talking about, and how infrastructure is a healthcare issue, because if you can't get access to a community facility, if you can't get access to a healthcare facility, then you can't take care of your health. If you don't have access to healthy food, if the food distribution network doesn't reach you, then it's a lot harder to use it to have a healthy diet when you can't get access to the food that you need. That all of those things are interconnected. And so this, I think, already has been a rich opportunity to get to know one another and get to know one another's vantage points. And I'm excited to move us forward. So yeah, Sandra, I see that you've got a hand raised. Let's hear it.
I think we also need to add another component to it, and it's our political landscape based on where we are. We are doing all this work, but if we're not making the changes, the policy changes that we need to make, a lot of times we feel like hamsters running on a wheel, because we know the things that need to happen to increase access to care. We know the things that result in hospitals closing. What Carrie said was really true, especially here in Mississippi. We have 74 rural hospitals here. Almost half of them are either closed or on the verge of closing. And the biggest issue is because we will not expand Medicaid, which will result in some of those hospitals receiving money back for their uncompensated care. When someone comes to the hospital and that doctor does the work, the nurse does the work, the janitor comes to work, somebody still has to pay for that. And if we're seeing people and not getting compensated, eventually that hospital, which is still a business, is going to close. So the political landscape, and where I am, there are no aims with the current administration to do just what we need to do. We just had a short win when we extended Medicaid for postpartum women because we recognized they needed more than 60 days to recover from having a baby. So I think that, if we're going to have these conversations, we just really need to be candid about some of the infrastructure things. And one of those is a revamping of our political landscape so that we're working more together and not just tying down to one party or another party, but looking at the overall picture and how that's going to help everyone in the community.
I see that we have that you all want to respond. I'm going to just invite you to go ahead and respond in order here, and I don't have to moderate. So go right ahead.
Well, I think I think we are a nonpartisan organization, so I think we advocate for what is best for healthcare in a rural area and the people who live there. So that's how I kind of look at the lens. And I just want to kind of add on to what Dr. Melvin said, with the infrastructure in rural areas, I mean, the thing we know, and I know Dr. Melvin has spoken to this, but I just want to re-emphasize, when we have a hospital close, if you look at hospital vulnerability and hospital closures, it is not evenly spread across the country. We see a lot of our closures, a lot of our most vulnerable facilities are in the south and southeast parts of the country. We know that when hospitals close, the individuals who oftentimes have the most significant impact in terms of access to care are populations on Medicaid. They're populations who don't have the ability to, drive 90 minutes to get to care. And that's especially impactful when we start talking about obstetrics and OB. And, I talk to rural hospitals all the time where 80-90% of their births are individuals who are on Medicaid. And if that facility can't offer that service anymore, that just creates this disproportionate inequity in terms of who's getting care. And so again, aside from all of the other kind of chaos that happens in our government that impacts health systems, it really feels like trying to figure out how we level the playing field so that our facilities can provide care to the people who need it and people can stay in their own communities to be healthy is really, really important. So Dr. Melvin, I was like, I just want to lift that up. It's exactly on point.
And call me Sandra, everyone.
I just feel like mine is such a mouthful with a hyphenated name, and I'm like a late earner of my doctorate. I just graduated last May, and so I'm like not used to it. So I want to make sure, again, to what Annie said, you know.
Yeah, go ahead, Rosa.
So I wanted to add to that because what Sandra talked about, the Medicaid, you know, the lack of Medicaid, the lack of interest in certain legislators to expand Medicaid, even though everybody knows what the benefits are. We in North Carolina, we integrated into this effort to push for Medicaid expansion, which we got, but what we, you know, leveraging the playing field, what we utilize is this perspective of the rural community, and this is specific to North Carolina because agriculture is still North Carolina's #1 industry. So rural communities have an untapped strength. We just brought that to the table and started pushing with that and saying that if rural communities do not have access to medical care with Medicaid expansion, this is going to impact maybe farmers, if they're big farmers and maybe they have the ability to financially make that 90-minute visit, but they may not have the time, right? But their labor force is going to really be impacted, and that means that that's going to impact their operations. So if you're a legislator in North Carolina and you're reckless with the agricultural economy, right, then you know you're going to be taken to task for that. And we made it an agricultural economic perspective. And when we brought that to the table, you know, you can talk to people about doing the right thing, but when you talk to them about money and when you talk to them about their responsibility, right, and their fiduciary responsibility that they have, they start to listen. So we're just speaking to them in a language that they understand, but we're bringing the perspective of the local agricultural community. And that's all of us. That's down from the workers to the stores, to the growers, to the schools, you know, even the schools in these rural North Carolina communities, they're over 50% Latino in their student body. They funded by the head, right? If you cannot have as many people, your whole community is going to be crumbling because you don't have the necessary essential infrastructure to keep people there. So that's when people started to get a little bit, oh, let's talk about it a little bit differently. So yes, that is a challenge to get that infrastructure. And if we can come from a position of strength, if we have it, and in North Carolina, we had it at least, but you know, so anyways, I just wanted to add that.
I mean, I'll just jump in on what Rosa said. You know, I fully stole this from USDA. I think it was Suchitoro Smalls who I first heard say this. But you know, whenever I am out speaking to folks, the 4 things I emphasize is that urban areas have so many reasons to care about what's happening in rural communities across the country. And the fact that rural areas provide the fuel, the food, the fiber, and I'm from Montana, so I say the fun as in recreation, is critical. And there is a symbiotic relationship there that we cannot ignore. And to what Rosa was saying, you know, in order to recruit economy to rural communities, in order to keep rural families in rural America, you've got to be able to offer healthcare. Like, you are not going to be successful in driving that economic engine that we need in rural America without access to, doctors, clinicians, facilities, and the support that they need. So yes, Rosa, I'm totally with you there.
And I just want to add something to what you said, Rosa, about making that economic argument. We have done that. And let me just say this too. I want to make sure I'm a nonprofit, so I'm nonpartisan. I just speak the facts, look at the facts, educate, advocate. However, between 2013 and 2022, Mississippi left $14.5 billion on the table because they did not expand Medicaid. We have made the argument about the money, and this is what people also don't know. That money is not, you can use that money for other things. It's not just healthcare. So when we talk about the infrastructure of a rural community, if you're giving back $14.5 billion, then you really are just really cutting your nose off to spite your face. The money is there. We know we have all of these issues, and we still refuse to move the needle on this. And a lot of it, you talked a lot about community and, empowerment. And also, I think health literacy, being able to understand what your power is, and then mobilizing the communities to be able to speak for themselves and make decisions that help them to be successful in getting the changes that they need. And that's one thing I think here, especially in the South, that we don't do. In African American communities, sometimes we don't know that we have the power to do certain things. And because some things are systemically done, we make sure that it's set up so that we aren't able to do that. For example, in southern states, we have a lot of redistricting. So even if you vote, how much does your vote really count? We have things like expungement. I mean, when you talk about policy, some people can vote. They just have to get their whatever the records are expunged, or there are some things that people go to jail for or prison for that they can still vote. And I don't think people understand that. It's an automatic, I went to jail, I can't vote. And that's not the truth. So for me, as a community advocate, I think a lot of what we need to do is educate our communities about what the real information is so that they can go out there and be mobilized. But when you leave $14.5 billion on the table, no amount of economic argument is going to help. Now, what I will say is we also have to look at what is really going on, because during COVID-19, one thing that we did see is nobody had a problem expanding any programs to make sure that everyone in society had access. And the reason is because it wasn't just minority communities being affected, everyone. COVID didn't care what color you were, what your sexual orientation was, didn't care if you were male, didn't care if you were female. Everyone was treated the same, because at that point, you couldn't isolate certain people and not spread COVID. So in order to get a handle on COVID, we expanded Medicaid or made access to care available for everyone. So we know that deep down, everyone knows that it should be done, because when it was necessary to do that, when we were in the middle of the biggest pandemic of our lifetimes, we had access to care. We had free PPE, we had free COVID-19 tests. Your bill got paid if you had to go to the hospital for COVID-19. So we know that people already know what needs to be done. And I think it's more of a mental change that has to happen with some of our legislators to understand that giving someone access to care is not going to make everyone in Mississippi be on welfare, because I think that's what people think, that helping or expanding Medicaid adds all of these people to the welfare rolls. And that is not true, because the reality is most people that will benefit from Medicaid expansion are working every single day, and their jobs just don't provide insurance, or they don't make enough to be able to pay. Or you're on the cusp of, you make too much to get Medicaid, but you don't make enough to pay if you have to go to the hospital. And I think that's the mindset that we need to change if we're really going to be able to implement policies that will have an impact.
Yeah, mental snap all around. I'm wanting to just say back a couple of the things that I'm hearing from you all and give you an opportunity to respond if you feel like I've gotten it wrong. But I'm hearing that a couple of things that are pretty widespread that we could rally around collectively are Medicaid expansion, They are treating healthcare and access to healthcare as an economic issue and an economic development issue. And going upstream and thinking about civic engagement and the attack on civil rights and specifically voting rights as an upstream impact that is leading to some of the impact in the healthcare systems and the healthcare infrastructure that we see. So I want to give you a moment to think about like what might be missing from that, and then maybe just to prompt you where you might see any of these issues being particularly beneficial in rural communities, if you might be able to speak to that.
And I'll jump in. One other thing I'd love to throw in the mix is we talk about the economic development component of healthcare. I think what we're seeing so much of recently, especially as healthcare is trying to move towards kind of a population health, recognition of the fact that the term that we use of the social drivers or social determinants, but all of those things like food and housing and transportation have so much of an impact on your health, even more so sometimes than the actual, care you receive in the doctor's office. One of the challenges that I feel like I run into a lot as we talk about this work is just the limited capacity that's in rural communities, especially around like partnerships with community-based organizations. There's just not the same resource base to support that kind of work. And so I'd like to add to the list where we can think about building capacity in rural areas to take advantage of the federal resources and probably the state resources. I'm better tapped into federal, but there are resources out there. But when small rural areas are having to compete with more sophisticated, more resourced, and I don't mean sophisticated like intelligence or education. It's just purely like resource base. They don't have the same. It's an unfair platform in terms of competition, and so really thinking about how we get more capacity and resources to build capacity in rural areas would be another thing I'd love to add to your list, Annie, if Rosa and Sandra also see that.
I see that, but when I'm in the field, the biggest thing I see is that we talk about social determinants of health. But for me, there's really one social determinant of health that needs to be addressed, and it will naturally help all the others, and that's poverty. When you look at not having housing, not having transportation, not having access to care, the one thing that is common and is the common thread between all of those things is how affluent that community is. If we look at each of our respective places where we live, most of those disparities are concentrated in areas that are impoverished, low income areas. And so as we think about policies, we need to think about how do we remove how do we increase the amount of, like Carrie said, funding or resources that go into these communities, because they're poor communities. And everything else follows. Education, if you can buy a house, childcare. I mean, we talked about when my child was growing up, Annie, and, daycare was expensive, and it's still expensive. And it's even worse now because now a lot of daycare centers are not open. That is a major issue here too. Access to healthy food. In poor areas, we know that their selection is not as good as in other areas. So we have to think about how that plays into these social determinants of health. We can put a hospital there, but if people can't afford to go for the care, we're just building a building that no one is going to utilize. The same thing with schools. You put a school there, it's a poor area. Are people going, or are they trying to work or do other things to not be poor? So I think if we address that, we can do a whole lot more to address these social determinants of health.
Rosa, I would love to hear your reaction both to the capacity building call and for really putting poverty at the front of the line of social determinants of health.
I definitely agree that poverty needs to be front and center because many of the things that you talked about, Sandra, about, voting rights, for example. Poverty there's so many facets to poverty. It's not just bring more money, make more money. Some of these things, there's generational wealth that can't be overcome by now you got a better paying job, right? Or now you have more money coming into the community. But the kind of wealth, the biggest wealth generator is land or house, right? And that's been an area where people of color have been obstructed from entering. And in the case of Latinos, it's many times not attainable because we're talking immigration rights, right? So now we're talking immigration status. So if you look at poverty, you'll have to look at many things. The historical discrimination that people of color have faced in this country that have led to lack of ability to create generational wealth, right? And then you have to look at things like immigration policy, to impacting other people. So those are just to name a few, but there's so much depth in looking at poverty that I would have to say that if we only start there, if we use that as a starting point, we will have to look at these other things that are both historical, but are also happening right now, continue to happen right now. And then we have to challenge these systems that are in place. If it's a systemic change, we need to look at what are the systems in place that keep poverty alive. And that's for me, that's the reality. And in terms of, the capacity issue is some of the same things that are in place that are the foundation kind of maintaining poverty also are in the way, and the ability to be able to engage civically begins, I think, with a belief that you belong there. And that's been something that has been impacted by, I'll use the same two things, the historical discrimination on people of color, the exclusion, well, first of all, the criminalization of people, and then the exclusion of the very people that were criminalized. And then if you add that the immigration, the new immigrants coming in. So none of this is this is a systemic issue that that makes sure that people have at least this underlying thing that that I don't belong, or it's not for me. And so you have to overcome that. And that's not about how do we just vote? How do I make sure that I can vote? But many people who have the ability to vote don't necessarily vote because there is no representation. And that's an important factor. So more than just voting, we need to build our candidates who can be our representatives, that are going to be the people that will be responsive to us. Those are important things. And in some places, and that's why what North Carolina is pretty famous for, the districts. That's why that's so important. That's why that fight and what's happening, in Alabama, these are really important things. These are really important things. We have to understand that, but not just for where the numbers of us can vote, but where we can have our representatives coming from, being part of this. And sometimes we're not doing enough to cultivate new candidates for all different kinds, from the very local to the federal levels. Our communities have to be understanding that we need to be building this, right? It's not going to happen tomorrow, but it'll never happen if we don't start on it today.
Yeah, and that I think that leads me to a different version of a question I had prepared for you all around where there might be momentum that you're seeing. So the genesis I'm thinking of here is, what are some bright spots for us to look at as models or guides to how we can build more momentum for health equity, particularly in rural communities. But as you all have pointed to earlier in the conversation, there are these connections between rural and urban communities. But so I had thought about the National Rural Health Association working groups, as well as the American Hospital Association has some policy reports that sort of aggregate some of the priorities for rural communities. As you're speaking, Rosa, I'm thinking that the momentum might be more in that candidate cultivation, in that belonging space, in that space of representation. But answer as you will, where do you all see opportunity? Where do you see momentum? Where do you see bright spots that can help build collective voice and see policy change toward rural health equity?
I would say there's more in this current environment. There's a lot more emphasis being placed on where money is being spent, which to a certain degree is placing a spotlight on how money, especially at the federal level, is being spent. And I know in southern states, what I'm starting to see is they're actually paying attention to how money that comes into these states is being allocated. Because what we've had in the past is more of a top-down approach. Like our state health department would get the money and then they would choose the contractors to work with. And as a result, especially here, we would send a lot of money back every year. And so now I think they're paying more attention to that. And they're starting to fund more community-based organizations to do the work. Because what ends up happening when you have a top-down approach is all that money stays at the top. And the smaller organizations that are really out doing the grassroots work, they don't get the bulk of the money to actually do the work. And I think that now there is a kind of a spotlight about regarding how that money is being used. And unfortunately, one of the reasons is because we here in Mississippi have one of the biggest TANF scandals in the country, where all that money was being given for TANF and it ended up staying at the top and nobody really using it for the recipients that were supposed to get it. So I think because of things like that, there's more scrutiny on how this funding is being used. There's more scrutiny on how it's being distributed throughout these states. And we're not going to make an impact if we're not using the bulk of that money to do the work in the community. So the reallocation of those funds so that community-based organizations are able to get it and use it, I think is one of the bright spots for the work that I'm doing, because now we're not so much trying to get money from, the health department. We actually can apply ourselves, and they actually want us to be a part of whatever these initiatives are. So I think that that's a good place to start when you're talking about resource allocation.
Go ahead, Carrie.
I think from our perspective, I think two things that come to mind. I do think lifting up the kind of having an asset-based approach to rural and changing the narrative about what rural areas are and what it's like to live in rural areas, and really lift up kind of rural areas can be and have been some of the biggest leaders in innovations in healthcare, because there's more collaboration, people are doing more with less. And so really lifting up those success stories. We right now have an initiative that we just started around rural adults and aging in place and aging in rural areas. And one of the things we're really thinking about how we can kind of push out is this kind of rural by choice concept, right? And so I think trying to change the narrative and, you know, to the extent that we can take some of the, and I know that you can't, but try not to paint all of rural America with the same brush, right? It's so easy to say, you know, it's all angry white farmers, right? And we know that there are so many other folks living in our rural communities and make up our rural communities. And so I do think like changing that narrative is important. And then for our work is we are really a member-driven organization. Annie, you talked about all of our policies are policies that our collective membership have voted, like identified and voted on and determined that this is the direction they want to take. And so my job really is to help people be advocates and to figure out, kind of demystify the advocacy process and get them the materials they need and think about how we can do that education and outreach. And so that's really where we focus a lot on making sure that we're giving people the resources and materials that they can then use to lift up their voice. So those are kind of two areas that we've really been thinking about and focusing on recently.
I would like to add to that where I see that there is some I guess some opportunities, and I tend to, along with the asset-based kind of approach, I tend to, you know, we kind of work things in a way of seeing things, the realities, and then the opportunities. And sometimes when you look at things through this sort of needs-based lens, you don't see the opportunities that are there. Now, some people say, well, you're just calling the needs realities, but it's more complex than that. And in some cases, maybe there is a choice involved, but in other cases, it's just a reality, right? That is not based on not a reality because of a choice. So that's one thing that I think that I see a lot of opportunity for growth is that starting from where rural communities, and they're all different depending on where, you know, I mean, include Puerto Rico in that, you've got a world of difference. But where there is coalition building that happens where there's many sectors, it's across many sectors. The trick or the art to that is to see the interdependency. So advocacy efforts can be stronger, inclusion can be attained. But the art of that is identifying, and sometimes when coalitions are built, they're built on, you know, what things are that we have that are similar, right? Not necessarily, we may be very different, but we have points of connection, points of where we cross over. And it's at that, when we realize this, we not only have strength locally from at the local level, because we're gaining some of that strength from other places and from other sectors. But we then start to have a different kind of strength. We start building this kind of force or fuerza, power, that people are realizing that we've connected the dots. And the game is, you know, keep the dots separate, right? That's been the, not game, that's been how the power has been weaponized against us, right? All these dots are going to be separated, right? So once people start realize, once the power starts to realize that, you know, they may be used to dealing
certain entities or certain infrastructures, like, for example, hospitals. That's a big thing, right? They have access to different power structures than people in the community. But when hospitals can come together with people, regular people in the community, and share that platform, that's a difference, you know. So I think this kind of coalition building that connects us in an equitable way. So the task is for everybody, not just the ones that maybe take up some or hold some kind of power in a different way, and maybe the more conventional way where, you know, the board of directors of this particular hospital, they serve the community, but they're regularly in contact with folks in the county government or the local government, whereas people in the community are not, right? But there's a process for both the people who are holding that power, and also there's another process for the people who have not been historically included in that. Both have to work on it. Equity has to be built. It doesn't just, you know, come over, I'll just include you on my table and voila, we have equity. That's not the case. We have to build it together. It's an intentional process. And that's where I see a lot of opportunity. I see that as very powerful. Connect the dots and show up as a united front. And not to say that it has to be a confrontational thing. I think it just has to be an inclusive, equitable approach to identifying and building issues, but also building those. And what you said earlier about you can have the, I don't remember who said, I think it was you, Sandra, you said you can have a lot of money going into big organizations who say they're doing something, but the reality is not only is maybe the misappropriation or misuse of those funds, but they're not going to have very accurate solutions because they're not as close to the issues. So, you know, when those big institutions can say, you know what, we're not as close to these issues, so we have these skills and we can use these skills. What we need is data, right? And not just let's us collect the data, but let's partner with folks who are the data, who can bring these perspectives that we're kind of far away from. And the people who have the knowledge maybe do not have access to those skills, that skill set, but that can also be brought in, you know? So it's that kind of coalition building where I see evidence of that happening. That's where I hold a lot of, I mean, that really gets me excited because I see that has a lot of potential. At least I believe that, I hope that, and that's what I work towards.
Rosa,
And hearing,
go ahead.
sorry, go ahead.
I just wanted to lift up one point that you said, Rosa, because I was thinking about this. One thing that we as nonprofit or community-based organizations do not do a good job of is when we have all these town hall meetings, what do we do with the data? You know, every time something happens in our communities, we have a town hall meeting. That's the first thing we're always going to do. But what I don't see is that next step, which is translating the information from the town hall meeting into something that can be used in that community. So definitely, I think that data piece from the community-based level is going to be so important. And we have proof. I think that was one of the reasons that we were so successful in addressing COVID. Because one of the things that they did was had series of town hall meetings, community listening sessions throughout the country in different communities to figure out what those strategies needed to be. And then they took those strategies and they turned them into interventions. So I think that data piece is definitely something that as a community-based organization, because we are close to the community, we need to definitely start taking it to that next level, which is have the listening session, have the town hall meeting, and then what goes next? What did we learn? And how can that data be used?
I just wanted to again sort of summarize a couple of the things I'm hearing in this part of the conversation around opportunities and bright spots. And I'm hearing that there are a lot of assets in communities, and particularly in rural communities, that are overlooked. I'm hearing that there is more opportunity for coalition building across geographies to build power. And I'm hearing that community-based and community-driven research can really put that power in the hands of people who are closest to who are in the communities, who make up the communities that we're trying to ensure have access to the power and the resources to thrive. I'm wondering if there are any stories, any specific stories that have come to your all's mind from your work, any particular communities that have been able to harness that asset-based approach, who have been able to do successful coalition building to achieve something, who might have had a community-driven research project that really put that power in and really acclaimed that power. I'm curious if any stories come to mind, or if any data is coming to your mind as you're thinking about those bright spots.
I have a particular group that
Well,
I would like
I'll
to.
just go back to the old standby.
See,
Go ahead.
we've got a delay, so sorry.
Oh, is it me?
You're up, Rosa.
Is it the delay on my part? See what my internet is. Sorry.
I think it's just having all four of us.
Okay.
But I think we're okay now.
So I'd like to what I think is this has been inspirational to me. I'm working with a group up in Utuado, Puerto Rico, very, very rural area that when Maria hit, the farmers took their machinery out and they fixed the roads. They did everything. They fixed the power. They mobilized people, and they've remained organized since then. And they have built, because even in Utuado, their community is very separate. So they have a group of 14 small community-based groups. The one I work with has just recently become an organization, and so they have a little coalition of the 14 communities, most rural in Utuado, and they themselves did a community-based research on housing, kind of housing needs. They also built community acueducto comunitario, which is water. Basically, you turn on the tap water and it comes from the city. Not here. It's a community-run acueducto that is in charge of taking care of making sure that the community is supplied with water, and by sectors. So there's like I think there's 14 of those sectors have their own community water. So once they did all this research about what are the housing needs, they were approached by a bigger foundation saying, we want to do this plan. They said, well, we already have the plan. Well, we want to partner with you to kind of get a plan for housing. They said, okay, we can work with the plan that we have. There's 14 of us. They selected some of them, not all of them. They pushed for more, so more people got involved. And housing is a major issue up there. So once the money started to get closer to, okay, we're going to have so much money, the municipality wanted to get involved, and they sort of infiltrated and began to pull. Can you hear me?
We had a little jump in it, but we've got you back.
Okay, you're back. Okay. So once the money started getting closer to being a reality, the municipality started to infiltrate and started to take over, saying, we have to develop a plan. When the community knew, they already had. They had all the data, right? They were beginning to develop a plan, but they needed to get more sectors involved. That's why they were willing to work with this bigger organization. when the municipalities started to infiltrate and said, okay, this is what we're going to do, this is what we're going to do, and this is how we're going to do it, the community organization and their 14 affiliates, they actually said no. They said, no, you're not going to steal our data and do whatever you want to with it. We're here to tell you what we have and what we need. And basically they were saying, we're going to go with what you say, but now we're going to take it and we're going to do, and you're going to have less control. They walked away. And I'm talking about millions of dollars, and they turned their back. And the municipality is scrambling because they know they can't do it. Now they have to present a different kind of plan saying, we have to do a study. But the funder is saying, well, we already know there's a study, right? But this has been a community study. So they have valued their data. And so it's at a standoff. I mean, I don't know if it's a success story or not at this point. I can tell you, for me, that's a success. But it's at a standoff right now. They valued their data. They recognize that this has value, and they're not going to sell it out. So it's that kind of confidence that I believe that they came to from having this cohesive group of people that have been working together since 2018. And that slow kind of, you talk about slow food. Well, there is this slow community building. If it's going to stick, we can't just plop in, parachute in and say, this is a plan and this is what we're going to do. No, this has been brewing and brewing and brewing. And it's reached a point where they can just turn down. Not that they have the luxury of saying, well, we don't need that money. But they all collectively decided, we're not going to sell out our valuable data unless we can get what we need, what we understand, that is what we have identified, and that we can have control over the process of that. At least to be in the center of that. They're not willing to hand over their power. That, to me, that's inspirational.
Carrie, did you have something that you wanted to share?
Yeah, I mean, I'm not sure. I cannot match that story. And I work very much kind of at the federal level. So I have other folks in our organization who can do kind of some more on the ground. I mean, I think from like a bigger picture success story is, or I guess the reason that I continue to do this every day and get up every day and bring energy to this issue is I do feel like there is growing momentum, and there is such committed individuals to this issue. I mean, NRHA, we work with right now. It was 43 state rural health associations, and we just had 2 new ones be created in the last 2 years. So, I think our membership is growing. I feel like our voice on Capitol Hill is growing. We just were able to launch a House caucus specific to rural healthcare. And I think the thing that I love about working, or one of the things that I find, so I am not a DC, like I am a lobbyist, but I am like, the politics of DC makes me crazy. And I think the only reason I can go and do this work day in and day out is that rural healthcare is an issue where we are able to still have a bipartisan conversation and bring people to the table and talk about what's best for their constituents. And we have a lot of work to do to make sure that everyone's voice is represented in that. But I do feel like it is still an area where we can make some progress. And so I think just the growing interest, continued support for it as an issue is something that I feel like is a success story, and am excited to kind of see where we can continue to go with it.
How about you, Sandra?
So I'll just add a quick one. I can't top Rosa's, but what I will say is during COVID-19 here in Mississippi, earlier in the pandemic, 60% of the deaths were African Americans. And after doing a series of community listening sessions, talking to partners, talking to the State Department of Health, we all came up with a uniform plan for how we would address it. And to make a long story short, as a result of taking the strategies, finding out what the concerns were, finding out what some of the barriers were, we were able to move by March 22nd to the percentage of African Americans dying because of COVID-19 was less than 20%. And I like to think that that was because we stopped getting them to go to the health department for vaccinations or going to these hospitals. We said to community partners, look, in your community, where would people come for vaccination? Or in your community, what is the barrier to it? And then we started addressing the barriers. So instead of them coming to us, we started going to them. And we have partnerships with faith-based organizations, other community-based organizations, state agencies, educational systems. We would have clinics wherever we could have them. We also set up, the Department of Health set up repositories so that we could have access to the things that we needed to distribute them out to the community, which was important. They may not know how to get access, but we could. And so we would get the access and then we mailed them out or took them where they needed to go. So I think that that's just a demonstration of how we can impact individual health issues if we work as a team, if we use the information that we obtain on barriers and then address the specific barriers. There was also an issue with the online system. In rural communities, some people they can't connect to broadband or internet. So it does not make sense for you to have them calling in or having to get on a computer to sign up. So we found areas that we could go to them. And I think that by removing those barriers, we were able to make the impact that we did, and we drastically changed what the outlook was for a lot of minority communities. And I think that goes back to, Rosa, to what you said about data. I think another important policy that we really need to look at is how current our data is. If you go on to most of these websites, this data is 2019, 2017, we're in 2023. And so by the next year, that data is outdated and it may not even look the same. So I think capacity building also needs to happen, in our databases so that we can have the most current data that we need to make decisions, because the decisions we're making may be based on data that isn't even accurate anymore. And so I think, at least no longer than 2 years, we should have data that we can actually look at that picture and see who's being affected, see if we're making an impact. What is the baseline? We don't know if we're making a change if we don't have the baseline data to answer that question. So I think that's another important change that needs to happen.
Thanks for lifting that up. As we roll into our last few minutes here, I want to hear what you think. It's with the vantage point that the audience for this recording is folks who are in rural communities who might want to understand rural health issues better. They might want to be getting engaged. What are some of the low-hanging fruit, some of the most available opportunities for folks to get engaged in advocacy, or if it's coalition building, or what do you see are some of the most available opportunities for folks to get engaged in the issues? And then I have one more question after we do a round on this one.
Well, I'll just plug that all of the material on our website is open regardless of you're an NRHA member or not. So like I said, part of my job is making advocacy as easy as possible for folks. We have advocacy campaigns where you can go on our website and get directly connected with your representative in Congress and help share our message. But we have lots of other resources to do that. So our website is ruralhealth.us/advocate. We'll get you specifically to our materials. And our information is on there. So if folks have an issue or something that they aren't seeing lifted up, please contact us, contact me, and I would love to work with you to make that happen.
Thanks. We'll definitely collaborate on that.
And I would just say the real low hanging fruit, I think, is doing your participating in the process locally. I know that a lot of times we go and we do our presidential elections, the big elections, but what is going to impact us most directly is what's happening in our community. So if we can get mobilized to participate in these local processes, I think that that's some low hanging fruit that may be more impactful to the communities that we know are most affected by health disparities.
And I'd like to add that I think the lowest hanging fruit that's right there in front of all of us is the people. People in the community have been undervalued, underserved, and I mean, we all know about the underserved, but the undervalued part. And I really want to say that what Sandra mentioned about the data and the fact that it's outdated, and how do we get data? Usually it's some academic institution or some big organization that does take a couple of years to even get that plan in place. And they have to go through all these hoops to get all this other stuff in place so that they can do a research. And then that's the years of doing the research. If these institutions or organizations would begin to see that they have data collectors that are on the ground, up to date all the time, and begin to include them in their grants as not just for this particular grant, but they need to be considered as a research arm. If you're researching something that's community, you need to have a research arm, a community-based research arm in place on the ground already, so that our data that folks are relying on to implement these multi-million-dollar projects or initiatives that may not be very effective because it's based on data that's outdated. So, I mean, to me, it seems like that's a very low-hanging fruit. Let's get these people not just as volunteers, but as valued data collectors, right? Part of the whole process, and build the capacity within the community so that that can interface with any kind of research that's happening. That's what I'd like to add.
Yeah, I appreciate that so much. And then my final question for you all, even if it's something you've mentioned before, but just so we can sort of have a recap here at the end, is there maybe just a 30-second summary that you could offer of one policy goal for rural health equity, or if it's a piece of legislation that you have in mind, that would be fine too. But what would be like the number one thing you would point to organizations or organizers to focus on that you think could be a rallying point toward rural health equity?
I can start. For me, it would be promoting diversity in the workforce. I think that's a low-hanging thing that we can do, and we can do it together in collaboration, because most of these rural communities are also health provider shortage areas. And so when we talk about policies, maybe how do we expose individuals in the community to healthcare to make sure that they're going into the healthcare workforce. I think that would improve the quality of healthcare that's happening in those communities. But the other thing is, a lot of these associations are made up of physicians, nurses, healthcare providers. So by increasing that diversity, maybe some of the policy things that we want to see would happen if we have more people that represent the communities that are using these services. So I think that would be something more simple that we could do. And there is some policy associated with it because they have to pay for their education to enter the field. So those may be some policy changes that are more acceptable or might be easier to make, as opposed to doing things like Medicaid expansion, which I think we still need it. But, you know, we have to start somewhere. So this may be a place to start.
I would like, this is I don't know if this is this is aspirational. okay? But it is, and that's what goals should be, right? So in terms of policy, you know, policy and poverty, policy has created poverty. Policy has continued poverty. And I believe, like Sandra mentioned, that, you know, addressing poverty is critical. But understanding how policies, so I guess sort of a policy analysis, how policies impact poverty, and giving it a, you know, whether it's a positive impact, a negative impact, and diversity is important in that because it looks different to different people. So for example, like the GI Bill was, you know, looks like on the face of it, looks like that was a great thing. But depending on when it happened, right, was it really accessible for Black folks? Was it accessible? So if you could not attend a college, or what about the housing, right? If you could not buy a house, what difference does it make if you had the money there? You could not do it, right? So therefore, you did not have a policy that had any positive beneficial impact to you. So these are the impacts. So I don't know how to say that, but understanding how policies positively or negatively are impacting poverty, that to me is critical, because if we cannot eliminate poverty, we're not going to be able to attain the equity in things like healthcare.
All right, Carrie, last word.
Yeah, I mean, I think when we look at specific opportunities coming down the pike, you know, I think the Farm Bill has a real opportunity for us to lift up solutions that will potentially address some of the things that we've talked about today. That the Farm Bill needs to be reauthorized every 5 years. It's up for reauthorization this year. TBD what's going to happen with the mess that's in Congress, but there's so much more in the Farm Bill than commodities, right? And so I think programs or policies that we can make tweaks around, for example, the rural development portfolio at USDA that really is core to being able to build our rural communities and resources that our rural communities really rely on. So I would say Farm Bill reauthorization is a place where we can bring up a lot of these kind of specific issues, whether it's workforce or facilities or telehealth and broadband, hunger. You know, I think it's a place where we can maybe move the needle a little bit on some of these issues. So I would say pay attention to what's happening in the Farm Bill and let's talk about what we might be able to do with that space.
Here. So just because you mentioned the Farm Bill, I want to make sure we get one more plug in here for the Rebuild Rural America Act, which is a marker bill for the Farm Bill, which has ambitious funding for rural communities through the Rural Development Portfolio. And I think it speaks to a lot of what we talked about today around really addressing poverty as a root driver of inequities in a number of fields and in a number of sectors, including health. And we see that as a path toward starting to reverse that trend of degraded infrastructure, disaggregated power, and really try to put the hands back in the power back in the hands and the money back in the hands of people in rural communities to design their own thriving community solutions. So that might be an opportunity for follow-up for all of us. I'm grateful that I got to have all of your expertise in this conversation. Thank you for your generosity with 90 minutes. I'm so grateful for that because you all bring a wealth of both experience and technical expertise that I don't hold. So it makes us stronger to work together. And I hope that this isn't the last time that we're all in conversation together. Is there anything that any of you would like to leave us with before we close our meetings?
I would just like to say it was nice meeting everyone. I learned a lot, and it's just refreshing to see that it's not just Mississippi, that there are people all over the country who are engaged in this work, and that there are resources that we have that we can use as community-based organizations and resources that we can use to give information out to our communities. So I want to thank you all for the work that you're doing as well.
I also want to, I'm really grateful for the opportunity to be in this conversation. I think that, it's always so amazing to hear what's happening someplace else and hear different perspectives. And it really has filled me with, some things to think about, and it has expanded, what I know, and has helped me to realize that it's helped me actually to be a little bit more inspired, and that's always what happens when when folks get together and talk. That's always what's happened. So I'm grateful for this opportunity, and I'm grateful that you got these folks together, including myself, because I had that opportunity. So thank you.
And ditto all of that.
Sorry, Carrie, go ahead.
I was just going to say, I really hope that this can be the start of a conversation. We'd love to think about how we could work more together, because there's so much to be done, and we are stronger together. So thank you for connecting us, Annie. And yeah, I look forward to working with you both, Sandra and Rosa, as this moves forward.
Thank you.
All right. Thank you so much. Have a great rest of your day. And I will be following up with you shortly.
Okay. Take care, everyone.
You too. Bye-bye.